Hello, welcome to any community. Do you know what do you mean by Yapya Vyadhi? Do you know what do you mean by Daruna Sadhya Vikara? What are the characters of Yapya Vyadhi? When do you say the person is suffering from Yapya Vyadhi? All these are answered in this particular video, which is entitling Yapya Vyadhi Lakshana. When you speak about Yapya Vyadhi Lakshana, it is also being termed as Yapaniya Vyadhi. Yapaniya in the sense we can able to manage the condition, but complete cure from the illness will be difficult. So the Charaka Samhita says, Sheshatva Daisho Yapyam Asadhyam Pathya Sevaya Lapthalpa Sukhamalpena Hetunashu Pravartakam Gambhiram Bahudhatustam Marma Sandhi Samashritam Nityanushayanam Rogam Dirghakalam Avasthitam Vidyat Dvidoshajam. When you think about it, if you split this, Sheshatvad Ayusho Yapyam Asadhyam Pathya Sevaya Labdha Alpa Sukham Alpena Hetuna Ashu Pravartakam Alpena Hetuna Ashu Pravartakam Gambhiram Bahudhatustam Marma Sandhi Samashritam Nitya Anushayinam Rogam Dirghakalam Avasthitam Vidyat Dvidoshajam Sheshatvadayusho Yapyam. Yapyam Sheshatvadayusho Pathya Sevaya Alpa Sukham Labdham Alpena Hetuna Ashu Pravartakam. So that means if you look into the description, the disease will be remaining with the patient throughout the lifetime. When the person is following Pathya properly, then the person will be getting the relief or he can able to maintain his health status. But Alpena Hetuna, if he is following slightest amount of inappropriate diet, etc., that may worsen the situation of the disease. Gambhiram, in the sense the disease will be deep rooted in the body. In other words, the deep-seated dhatu, for example, Medas, Asthi, Majja, and Shukra, that will be afflicted. Bahudhatustham, multiple dhatu are being afflicted in this particular disease. Further, Marma Asti Sandhi, affliction, the person will be having the affliction of vital points. And the person will be having the affliction of Sandhi also. In that way, so the Yapya Vyadhi that will be associated with these types of the Lakshana. Plus, there will be the affliction of two dosha vitiation that will be observed in this particular individuals. For example, the person who is suffering from Madhumeha. So that is the perfect example for Yapya Vyadhi. If the person is following the proper Pathya, then the Madhumeha that can be controlled. If that is not being taken properly, slightest amount of the Nidana Sevana, for example, if the person is taking the Madhura Rasa Ahara, such as the Kshira, Dadhi, etc., that may worsen the situation. So that is what is considered to be this particular description. And when you think about the Gambhira, so here, look into the example. Here, the right knee joint, that is totally getting disturbed. So that means Asthi and Majja Dhatu. So here, as it is being categorized under the Medas, Asthi, Majja and Shukra, they are categorized under Gambhira Dhatu. When there is affliction of Gambhira Dhatu, then it is categorized under the Yapya Vyadhi. When you think about the left knee joint here there is a redness is being present, which is indicative of the Pitta dosha dominance, and there is a swelling. When you look into the compared to the right knee joint, which is indicative of Kapha dosha dominance, of course that will be associated with pain also, which is indicative of the what do you say that the Vata dosha dominance. As far as Dhatu is concerned, Rakta Dhatu is being afflicted, where we are going to see the redness of the joint as such, plus Asti and Majja Dhatu affliction can be seen because of the presence of what do you say that the joint pain as such. That's why it can be categorized under Yapya Vyadhi. Whereas Marmashrita Vikara. Look at this particular patient or the individual. The lady is having the circumduction gait on the right side, specifically on the right lower limb. So that is circumduction gait, which is one of the presentation that is considered to be observed in Shiro Marmabhighata, which is an example for Yapaniya Vikara. Further, Marmashrita Vikara, based on that, if the person is presented with this particular type of the clinical presentation, where the person will be having the chest pain, which is one of the indication that the person may be suffering from Hridaya Marmabhighata. Of course, this is again a Yapaniya Vikara as such. Further, Sandhigata Vikara. When you think about the image, it is a patient who is suffering from chronic rheumatoid arthritis. So, wherein the joints are being afflicted. So, here joint deformities are also being seen in both the hands. This is an Yapya Vikara example. To sum up, Yapaniya Vikara, it actually literally meant as Yapaniya Vyadhi or manageable disease. In the sense, in brief, we can say if the person is maintaining the proper pathya, that will be leading to the management of the disease properly. Slightest the exposure to Nidana, that may lead to the worsening of the situation. It is considered to be the type of asadhya vikara, wherein Dharuna sadhya vikara can be categorized under Yapya Vyadhi. So as such, we have discussed slightest exposure to Nidana that may worsen the situation, plus Gambhira Dhatu affliction, multiple Dhatu affliction, Marma and Sandhi affliction are being observed in this particular type of the Yapya Vyadhi. Dear ANA community, what are the major key takeaways from today's discussion mentioned in the comment box below? And what is the one video that you'd like to hear in the coming days in this particular channel mentioned in the comment box below? And spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.